Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
Confusion, sweating, dizziness. A patient who suddenly becomes unwell. Is it low blood sugar, high blood sugar, or something else entirely? One small device can help answer that question. Today we're talking about the glucometer. A glucometer is a small handheld device used to measure the amount of glucose or sugar in the blood. Blood glucose is the body's primary source of energy. The brain relies heavily on glucose to function normally. When blood sugar becomes too high or too low, a person can become seriously unwell. The reading produced by a glucometer is usually displayed in millimoles per litre or mmol/L. So what does the glucometer actually do? Quite simply, it gives us a snapshot of the patient's blood sugar level at that moment in time. This information can assist first aiders, first responders, and healthcare professionals when assessing an unwell patient. Common reasons for checking blood glucose levels include known diabetics, altered conscious states, confusion, collapse, seizures, weakness, sweating, or suspected hypoglycemia. So, how do we use a glucometer? First, wash or clean the patient's hands if possible. Next, insert the test strip into the glucometer. Then, use a single-use lancet device to prick the finger and obtain a small drop of blood, usually from the side of a fingertip. Touch the blood droplet on the test strip that's in the glucometer, and within a few seconds, the glucometer displays a reading. Simple, quick, and often very helpful. Now, it's important to understand that a glucometer does not diagnose the patient. It simply provides one piece of information. The number must always be interpreted alongside the patient's symptoms, their history, their medications, their overall condition. Generally speaking, low blood sugar is called hypoglycemia. High blood sugar is called hyperglycemia. Hypo, low. Hyper, high. A low reading in a confused or sweaty patient may explain their symptoms, but a normal reading may suggest that something else is going on. And like any piece of equipment, glucometers have their limitation. Readings can be affected by poor circulation, cold hands, contaminated fingers, expired test strips, or incorrect technique. So the normal blood glucose level is between 4 and 8 millimoles per litre or mmol/L. Anything below 4, start treating them for hypoglycemia, and we'll cover that in a different episode. And finally, always follow your training, what you're credentialed to do, your organisation's policies, because a glucometer doesn't replace a patient assessment, it supports it. The patient always comes first, the number comes second, because sometimes a single drop of blood can tell an important story, but you still have to listen to the patient.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.
Welcome to your Daily Minute Podcast.